Hello and welcome to MedCentral. In this video we are going to talk about leptospirosis. Leptospirosis is a zoonosis caused by the spirochete Leptospira interrogans. Although there are over 200 serotypes, there are four main types that affects the humans. Those are Leptospira interrogans icterohemorrhagiae, where the normal host is rodents, Leptospira interrogans canicola, where the normal host is dogs and pigs, Leptospira interrogans harjo, where the normal host is cattle, Leptospira interrogans pomona, where the normal host is pigs and cattle. Leptospires are excreted through urine of those animals and enter the host through skin abrasion or mucous membranes, ingestion of contaminated water. You should also know that the organism can survive for many days in warm fresh water and up to 24 hours in seawater. This is traditionally an occupational disease which is associated with farmers, vets, and others who work with animals and those who come to contact with rodents or contaminated water. Outbreaks of leptospirosis occur with flooding. 90 to 95% cases are subclinical or causes only mild fever. Incubation period of leptospirosis is usually 7 to 14 days. The illness typically has two phases. Leptospiremic phase lasts for up to a week. Immunological phase. This is followed by an interval of couple of days. In the leptospiremic phase is characterized by severe headache, malaise, fever, anorexia, and myalgia. Also, most patients develop conjunctival suffusion. Some patients develop hepatosplenomegaly, lymphadenopathy, and various skin rashes. The immunological phase, which is the second phase of the illness, usually mild. Meningism is common, so if the lumbar puncture is performed, there is often CSF lymphocytosis. Majority of the patients recover uneventfully at this stage. In severe disease, there is no clear distinction between phases. After developing initial symptoms, patients progressively develop hepatic and kidney injury, hemolytic anemia, and circulatory collapse. Cardiac failure and pulmonary hemorrhage may also occur. Mortality is around 10% and rising to 15 to 20% in elderly, even with the full supportive care. So, let's see how the disease is diagnosed and managed. Diagnosis is usually a clinical one. Cultures can be done from blood or CSF at the first week of illness. You should keep in mind that culture requires special media and may take several weeks. Leptospiral DNA can be detected by PCR in blood and urine. Patients may pass organism in urine from the second week onwards. Confirmation of the disease is done serological. Specific IgM antibody starts to appear from the end of the first week. Diagnosis is often retrospectively made with a microscopic agglutination test showing the fourfold rise. Also, there is typically a leukocytosis and in severe cases thrombocytopenia and an elevated creatine phosphokinase. Management. Management is done by antibiotic therapy and the supportive care. Early antibiotics may limit the progression of the disease. In mild cases, if antibiotics are used, oral doxycycline is the best choice, but it is debatable to use antibiotics in mild disease. Penicillin or ceftriaxone should be given in severe cases. Intensive supportive care is given for patients who develop hepatorenal failure. So that's it for the video. Hope this video was helpful and thank you for watching. Subscribe for more videos. Also check out my other videos. Until next time, goodbye. Stay safe.